Hello, West Texas and New Mexico seniors. This is Valerie and Scott, and we're Medicare Medlocks. And
Hello.
we're going to be covering on this video, we're going to be discussing AEP, also known as Annual Election Period, and the best practices that you should be practicing this 2021 season.
That's right. Look, right now, this can be a very confusing, could be a very complex time, right?
Very.
And, you know, you're inundated with the telephone, the TV. You're not really sure what to do, what to make of all this sort of thing. Well, look, we'll break it down. We'll make it easy for you. At least that's the intention, right? So what we have right now is your period when you're on Medicare. Remember, let's do a real quick intro. You have two paths to Medicare. All right. The first path is that you get your original Medicare. Most of the time, you get a standalone drug plan added to that. But you can, maybe you go to the VA and you don't. So fair enough. One path is original Medicare. Second path, hand is disappearing in the mix. Second path would be that you get a Medicare Advantage. Remember, Medicare Advantage would be that company becomes your Medicare, becomes your Part A and your B, meaning your hospital and your doctor and things of that nature. So what does this all mean? What does that mean to me? How does it mean to me? Okay, what this means is this. This is a time of the year that you can check on what you have now and see if it fits your needs for, say, 2021.
Right. So wait, Scott. So you're saying whether I have one original Medicare with a Medicare supplement perhaps and a standalone prescription drug plan, or I may have a Medicare Advantage plan.
That's right.
So right now during this time of year, October 15th through December 7th, I can check my plan.
That's right. That's right. Now, I will say, for full disclosure, that if you have original Medicare and you have a Medigap or Medicare supplement, you can change that at any time of the year. But for the purposes of the video, to make things easy,
for AEP
itself,
period,
I would say that no matter which path that you're on, it's advisable that you check what you got and see if it suits your needs. Now, you might say, well, what do you mean suits my needs? Okay, here's what I mean. If you have, let's start with original Medicare, right?
Medicare.
That's right. You have original Medicare.
Supplements.
Most of the time, unless you're VA benefits or something, but let's stick with the majority of people. They get their original Medicare. Most of the time, they have a Medigap or Medicare supplement that covers that 20%. Remember, Medicare in that case pays 80%. They have a Part D plan,
a
standalone drug plan. It's advisable that you check that with the medications that you're taking right now, to make sure currently,
because we can't predict the future. You only know what you take right now.
That's right. It's advisable that you check to make sure to see what the difference is between now versus next year, to see if there's going to be, did the formulary change in that standalone drug plan? Is it going to be the same? Is it that drug plan, is there another drug plan that's paying more of the co-sharing than the one you're on?
Add something?
Absolutely.
Also, what if are you paying less money at a particular pharmacy versus a pharmacy across the street?
That's true.
These can all be factors that can be taken into account, whether you can save potential lots of money for the upcoming year.
That's right. That's a good point, because you do need to make sure that the pharmacy you're going to, is it in a preferred network or standard network? Yeah,
or
that's
is
a good
it not in network?
Or not in network at all. That's very true. Very true. So again, on original Medicare, you have a Medigap or Medicare supplement. It'd be nice also, I'll throw this in there, to check to see if you have a Medigap, a Medicare supplement. Maybe it's the time to really see, if your health permits, can I save some money on what I have, right? Who doesn't like saving money? We all do. Right, me too. Okay, so if you have original Medicare and you have a standalone drug plan, advisable that you check to make sure, like Valerie says, to make sure the formulary is going to suit your needs for the lowest drug cost for the following year, which would be 2021.
That's right.
Now, that's my one path. If you went the second path, which is your Medicare Advantage, then most people get their Medicare Advantage with a drug plan in it. Again, exceptions. They could get VA benefits to get their drugs, perhaps.
So one way, Scott, just to make it clear, one way would be a Medicare Advantage,
just by
also
itself,
known as MA.
That's right.
Or you would have a Medicare Advantage with a prescription drug plan, known as MAPD.
Right. True. Okay.
Correct?
Good. Yes, that's right. Good clarification. So if you have an MAPD, even an MA, really, it's advisable that you also check, because remember, on a Medicare Advantage, those are yearly agreements. Mm-hmm. That means that plans can change.
And not just that, but their ratings also change.
That's true. And
yearly, the star
it
ratings.
is good to look at that to see what the ratings are from one year to the next. Mm-hmm. It's also good to see if the doctors that you're having, say in a Medicare Advantage this year, if next year they're going to be there, is there some new doctors that are added to the network perhaps? Maybe some that you want to consider.
Perhaps some extra benefits.
Were added to the plan that you may or may not be interested in perhaps. So it's good to see in the network that you're in the location that you're in.
County and
the county and state specific, because remember, Medicare Advantage are all over the spectrum. So it's good to see what benefits suit you best. There is no right or wrong answer to that Medicare Advantage plan. So we think it's best that you just look at all of them and see, okay, are all my medications, what difference between what I'm in now, or perhaps you're new to Medicare and you're the first time on a Medicare Advantage and you want to see, which is the best plan for your needs that'll cover the medications for your purposes, which doctors, are in that network, what extra benefits, like Valerie said, are covered in that network. And that might be one path. Because remember, guys, there's two paths to getting your Medicare. Getting original Medicare, which most of the time you add a Medigap or Medicare supplement. Remember, or the second path is to get a Medicare Advantage that you may or may not get the prescription drug plans with it. This is not a video to differentiate between the two. It's what is the difference. This is just to say,
and how it
what should I do
applies
with
to
AEP?
you this time of year when you're hearing AEP. You must act now. And so what does that mean to you? And that's what Scott is breaking down.
And you have some time frame. You don't have to act the next 5 seconds. You don't. You have some time to really digest the information.
Ask questions. What are the stages in the Part D mean? How does this affect me personally with the medications that I'm taking and the pharmacies that I'm going to?
That is very important. The 4 stages of the drug plans is important. That what stage catastrophic is. What's the dollar figure?
What are the projected co-payments that I'm looking at in the future with the current medications that I'm taking right now? Also,
based on, now again, it's impossible to predict the future, but you could get an idea perhaps of just what you know. Remember, information is what you know right now, not of what you don't know.
That's right.
What you know right now perhaps could be that of how many times of doctor visits use right now, right? You might take that in consideration to maybe form some sort of evaluation for how much my cost for my healthcare may or may not be, right? In other words, if you go to the doctor and you know that right now you go 2 or 3 times a month, that could be a factor in a consideration to figure out what the co-pays could be.
Reviewing the plan details per
That's
plan.
Right.
That you
to see what best suits your needs. Again, we don't know that if you'll go to the doctor next year, 30 times or 20 times. No one knows that. But you do know perhaps what you're using it right now could be maybe a guesstimate of what maybe your usage for your health care, on the plan that you choose. Remember, the original Medicare or the Medicare Advantage. Again, AEP, it's all about seeing what's best for you to see what plan suits your needs. That's what it's really all about. It's your time and your Medicare journey.
Where you get to take care of yourself. You get to evaluate the plan. If you're happy with it, do you hate it? Do you hate the customer service? Are you just in love with it? Whatever it is that
there's no right or wrong answer, really.
On, it's about you, and make sure you really dissect all your options so that you make the best decision based on your needs this season.
We hope this helps, guys, and have a happy AEP, right?
That's right. Woo-hoo.
Take care.